Depression does not discriminate. There are people from every single background you can think of who are depressed. There are people who you look at and you would never guess that they're suffering on the inside, but they really are.
Before we even saw our first patient, we thought, who are we serving? What are their needs? What does excellence look like? What does safety feel like? And we translated that into a journey of care where no detail is too small to provide the gold standard of care for our patients.
This is 302, take 1, soft sticks.
This is Chandler Kauffman. I directed and executive produced the Ember Project through my company, Entropy Filmworks. My first impression of Ember Health was how mission-driven they are, from the founders and medical staff all the way through to the receptionists. There's a shared goal of providing the best possible care to their patients, and I was struck by their compassion and clarity of purpose, which carries over to their brand and how they position themselves in the healthcare landscape. This project was client direct without a traditional agency involved. The founders of Ember and myself collaborated on the creative, with launch strategy handled in-house by Ember's development team. The overarching goal of the campaign is to establish Ember Health as the gold standard for IV ketamine, both for patients and for the mental health practitioners who refer patients to Ember. Ketamine is increasingly in the public conversation, but often through sensational headlines and misinformation. Meanwhile, Ember Health has been in the field since 2019, diligently perfecting their practice as the gold standard for IV ketamine treatment for depression. They weren't advertising, they weren't seeking attention, they were quietly doing the work, and as I came to find out, changing and in several cases, saving people's lives. Ember is a practice defined by intention. Founded by a husband and wife team, every detail is carefully considered, from the calming design of their clinics to the small stones given to new patients as a symbol of resilience. We realized the campaign shouldn't feel like advertising. It needed to reflect the authenticity of the people and the mission behind their work, as well as amplify the voices of the people who have been helped. Approaching the project as a documentary series, we worked with a small crew of seasoned doc filmmakers, shooting as many as 6 interviews per day over the course of 4 days, plus copious amounts of B-roll, and we filmed an actual ketamine infusion with a consenting real patient. The campaign includes 8 patient stories, a founder story, and a series of films profiling Ember staff, mental health professionals who refer to Ember, and 2 films guiding patients through every stage of IV and ketamine treatment. What drew me in, and what surprised my team and I the most, was the caliber of people willing to come forward and share their stories. The diversity of their experiences reveal a remarkable resilience and hope. The campaign is launching now on social channels and Ember's website with a broader media buy planned. As a filmmaker with more than 20 years experience in advertising and commercials, this has been one of the most rewarding projects of my career. Ember has been an extraordinary partner throughout the process, thoughtful, intentional, and deeply committed to their mission. This project has been a rare opportunity to use brand storytelling to make a real difference for people suffering from depression and to help raise awareness of a treatment that benefits 84% of Ember's patients.